What inspired you to establish Duty Doctor in early 2023?
First of all, we all know that people struggle to get GP appointments. That's a common thing that's widespread across the country. And I see that clinically and professionally often in the service that I work in at the NHS at the moment. But also on a personal note, unfortunately, we've really suffered as a family. So back in 2022, my father became really unwell. He had both his legs amputated, he had sepsis twice, and he had 14 admissions in 12 months. So he was in and out of hospital during that period. Unfortunately, we really struggled to get GP access during that time too. So even though I'm a doctor myself, it's very hard to be objective when it comes to your family members, as you can imagine, and as I'm sure you're aware of, and emotions get involved and so forth. So we really struggled, and I thought I have to do something to try and address that situation, not just for ourselves as a family, but for everyone out there who's really struggling and finding it difficult to access a doctor. Having been a doctor for 18 years and a GP for 13 years, and having also worked in the private sector, both in the UK and internationally in Abu Dhabi and Dubai, I thought, why do I utilize those skills and that experience to do something to address that situation?
Oh, yeah. So before Duty Doctor, what challenges did you observe in the UK's healthcare system, and how does your platform aim to address them?
I think having worked in the UK system for a long time now, 18 years, as we mentioned, I've seen a lot of change during that period where people really struggle to get through, whether it's the morning 8 a.m. rush to try and call their GP practice, or even go into their practice and having to wait for 2 or 3 weeks to get an appointment on average in their GP practice. So people really struggle to get that access. In addition, when they do get access, they often find that they can't choose that doctor that they want to speak to. Maybe they've spoken to beforehand, so they don't have the choice often. They just get given the doctor who might be available, which is understandable given the pressure on the system. But in addition, if they do see someone and they like that doctor, or they've had a good rapport and relationship, they often don't have that continuity of care, which really lacks nowadays compared to before. So these were some of the big challenges, access, that choice, that continuity. And with Duty Doctor, we're trying to address all of those. So you get to choose which doctor you speak to. You can follow up with the same doctor should you wish to. And it's very easy access, whereas on any phone, tablet, laptop, or any internet-enabled device, and it's same day or next day appointments always available.
Yeah, and you talk about the technology bit, so I want to hear more about that actually. So how does Duty Doctor leverage technology to streamline healthcare delivery and enhance patient experience?
Doctor uses technology to enhance the user experience and the patient experience in healthcare, which often really lacks in sort of the NHS system generally. And by doing that, so we have healthcare at your fingertips via any internet-enabled device, as we mentioned, so on your phone, your tablet, your laptop. It's like a video call, or you can have an audio call if you want to as well. And we have an electronic prescribing system, much very similar actually to the NHS system, where you can get a code sent to your email and you can take it to any pharmacy across the country. So we're using that experience where it's very convenient, is on your device. You'll be able to speak to a doctor that day or the next day. And in addition to that, we're using AI as much as we can do in terms of helping both the clinician and the patient. So with the clinician, we're using AI to help with their note taking, but that will speed things up, that'll make it more efficient. But that also allows the clinician to engage with that patient, to maintain eye contact, to actually speak to them rather than sort of typing and looking down. So we're using AI in that aspect and in other aspects as well. And just to make it more efficient, more streamlined, more quick and easy access for the patients themselves.
Yeah, amazing. And AI is quite an interesting part, so I want to ask you a question about that as well. I guess the question I would say is like, how do you balance like the personal touch of healthcare and medicine with like the power of digital technology and AI in your platform? How do you balance that?
Obviously, AI is an incredible thing, an incredible technology that we've come across in recent times, and it's going to transform aspects of all life. And in healthcare, I think often people still want that personal touch, even though AI is really good and it will make things a lot more quick and more efficient. Um, Individuals still want to have that conversation with someone that they feel they can trust, someone they can actually engage with, and not just a robot or a computer on the other side. So I think even though it will really help, I don't think it will replace doctors. And I feel like having that face-to-face video consultation or even the audio consultation, you still get to speak to a real life person. And that's how we're trying to balance things. So even though we're incorporating AI, it's not replacing the clinician.
So I want to ask a question about GP stuff because I think that's quite an interesting topic as well for GPs as a whole. What do you think is the biggest hurdle for GPs looking to transition to private practice?
GPs aren't used to private practice in their training because it's not something we're trained to do. So often it can be there can be a bit of apprehension, a bit of worry because it's in some ways very different. Often people would think that the expectations are a lot higher, and that isn't always the case necessarily. And you might think, oh, we have to prescribe all the time, or we have to investigate all the time, and because patients are paying for it, and that definitely isn't always the case. So I think often clinicians will find it quite challenging and quite difficult with that apprehension because they're not used to that kind of environment. And when you kind of thrust yourself in that environment and you actually go through it, it becomes a lot easier and you become more accustomed to it. So I think the most important or the biggest challenges are the fact that people aren't used to it and it is a slightly different way. And there may be some different expectations because also when the individuals are paying for the service, but it is similar in so many other ways, though, to the NHS.
Yeah, understood. And I guess following on from my question is like, what kind of support systems do GPs need to succeed? I guess both like professional and personally.
I think it's really helpful to have a really good team around you with different multidisciplinary team members, whether it's clinical or non-clinical, depending on which service you're in and what kind of service you're offering. And so having that team ethic is really crucial. And even though often doctors, GPs in particular, will work almost in silos in their own practice, where they'll be working in their own room and seeing patients for a long period, I think just having that team available and having the ability to speak to other people if you need to is such an important thing. Because otherwise it can be very lonely and very difficult if you're just by yourself. And so that's essentially the main thing. I think having that team around you helps support you where possible. But in terms of other support, having adequate IT systems and infrastructure in place is really crucial because that will allow you to work better and more efficiently as well.
Yeah, 100%. And you obviously you're having like a digital healthcare platform in the GP space. Do you think GPs are underutilizing like digital health innovation? And if so, like how can it be addressed? Or what are the main things they need?
I definitely think GPs are being underutilized because I feel with the GPs in this country, they would have gone through 10 years of training, education, training, and experience to get to the GP stage before, they become qualified. So they've got a wealth of experience clinically, but also in a GP setting, you do learn to work independently as well as in a team. So, and you learn to adapt to different situations on a constant basis because you're having patients who walk through the door with different problems every single consultation. So I think that adaptability, that experience, that education really stands them in good stead. So I think in terms of digital health, GPs are pivotal and crucial in terms of providing primary care. And I feel that they are probably used as much as they could be. And I think having GPs at the forefront, especially in primary care, will make a massive difference to innovation going forward.
Yeah, agreed, 100%. As a GP, what are the key strategies can you recommend to those looking to like grow their prior practice, for instance, based on what you've obviously seen and done?
One of the most important things, obviously, is marketing because you may have the best product, the best team, or the best service out there. But if no one knows about you, as we've discussed beforehand, then it doesn't mean anything. So I think marketing is really crucial. And there are different ways of marketing, as we all know, whether it's adverts or SEO or leaflets or word of mouth. So marketing is a massive important thing that I think often is underutilized and underestimated. In terms of innovation as well, I think that's another important strategy to always keep innovating, to always be up to date with the latest technology. And sometimes, unfortunately, take some risks as well, because without a risk, you won't know if you can be even more successful than perhaps you would be otherwise. Sometimes it is about taking risks, calculated risks, and as long as you feel comfortable with that. But I think being on top of innovation, marketing, and utilizing your existing team.
I wanted to ask, so you're obviously quite deeply involved in health tech and healthcare. So the people in our audience is like healthcare professionals, but also like health tech entrepreneurs as well. As someone deeply involved in healthcare, what's one piece of advice you give to maybe another health professional thinking about entering a sort of digital space and like where to start and so forth, and from based on your experience?
Yeah, the most important thing is to believe in yourself and believe in your ability, because there'll be a lot of people out there who will say that it can't be done, or you can't do it, or it's not going to be successful. But as long as you have that belief in yourself and those around you, the world is your oyster. So I think that belief is really, really crucial. And there's a lot of things that will happen that are negative, and you'll feel really down and you'll feel like you're struggling. But if you can get through all of that, you can do the best you can do and you'll be amazing.
What does the future of healthcare and the medical field look like to you? And how is Judy Doctor trying to help shape that future?
It is changing rapidly in healthcare. I mean, things are transforming all the time. And although things were very different when I started out 18 years ago, where you would be a bit easier to get doctor appointments, GP appointments, even though it's still relatively difficult. It's much more hard now to get an appointment. I think things will get increasingly difficult. Waiting lists will increasingly rise, despite the extra funding that might be provided. I feel like things are becoming more and more challenging in the NHS. So as a result, I do feel there will be more scope for services like Duty Doctor to help support the existing, not necessarily replace. And we're not looking to replace the NHS because I feel, that's such a crucial part of the UK and the UK culture. But I think to help support and provide an alternative option for those who might wish to pursue that option.